Joining me now is Shannon Yarosz, Assistant Professor of Pharmacy Practice with Cedarville University. Thanks again for joining us this afternoon. Let's start with this. What does it mean when insurance says a medication is preferred?
Yes, so health plans have lists that they call formulary lists. And those lists have medications on them that will typically have lower cost or out-of-pocket cost to you. So preferred usually is that list containing those drugs that have lower cost. There are non-preferred drugs that the insurance will have. They can sometimes still be covered, but there may be paperwork involved or they might have a higher out-of-pocket cost to you.
All right, now if my insurance won't cover a medication, what are my options?
Yeah, so there's a few options that you could do. So if you go to the pharmacy and you find I have a really high cost here or it's not covered, one thing you could do is if you're on a brand medication, some manufacturers offer manufacturer coupons. So if you qualify, that could be an option. Another option is that some pharmacies have discount programs or coupons that you might qualify for as well. So it's worth talking to your pharmacist. Another option would be if you talk to your healthcare provider and let them know, they may be able to find another medication that's appropriate for you that could be covered.
All right, well, this is a common question. I think I'll bet you hear all the time. Why does my insurance cover generic medication but not name brand?
Yeah, so generic and brand names. So the generic medication has the same active ingredient as the brand medication, but typically the generic medications are more cost effective or have lower costs associated out of pocket. So that's usually why they are on those preferred drug lists that we were talking about before.
Right.
So usually you'll see the generics on that because they are lower cost than the brand. It doesn't mean necessarily that a brand is never covered, but again, it goes back to maybe having some paperwork involved or maybe a higher out of pocket cost.
Now, if a medication is causing some unwanted side effects, is it wise just to stop right away?
That's a great question. So I usually say, I'll start with this. If you are having a severe allergic reaction or a severe reaction, you do want to seek medical attention right away. But if you are having one of the common side effects that are associated with a medication, talk with your healthcare provider. There are ways that perhaps they could change the dose to help with that, or maybe switch you to another medication. It's good to be familiar with what those common side effects are. When you first take the medication or get it from the pharmacy, ask your pharmacist to see what you can expect, and sometimes that can be helped. So you don't want to just stop it. You want to let your healthcare provider know.
Well, on the other end of the spectrum, say that medication's working great and I feel fantastic. Yeah. Is it okay to just stop taking it once I'm feeling better?
That's a great question as well. So a lot of people do this with antibiotics. So antibiotics are usually used for 7, 10, 14 days, depending on what's prescribed to you. They start to feel better and they want to stop it, but you don't want to stop your antibiotic early. And that's because even though you're feeling better, you could still have that infection, and you want to make sure you complete the therapy to really get rid of that infection so it doesn't come back.
All right, sounds good. Shannon Yarosz, Assistant Professor of Pharmacy Practice with Cedarville University. Thanks again for joining us. We always have a good time when you stop by.
Yes, thank you so much.
Now, if you have a question that you want answered, you can do so by heading to the Ask the Pharmacist website. Just visit cedarville.edu/askthepharmacist.